Last month, industry spokesman Paul Offit at a workshop, said that it's not viable to bring lawsuit by a parent who accuses an unvaccinated child of making her child ill. Why? Because disease are mutable, and the replication cycle is rapid. It would be very difficult to prove with certainty the origin of the disease. Myth that unvaccinated kids spread disease. Myth number 2, parents with choice vaccinate less. That is a myth. CDC data in 2009 states that 90% of U.S. kids ages 19 to 35 most get MMR less. And in New Jersey, 86.9% is below the national average, 3% points below the national average. 20 of these states who believe in personal exemption, all but 2 have a higher compliance rate. These have higher vaccination rates. I just felt it's important that you need to know New Jersey is the only state that is all or none. Parents should at least have a choice.
Thank you. What's that? Ms. Steinhagen, Mr. Harris. Opposed?
Also ask Dr. Wenger to join us.
Please, is there any questions?
Harris, New Jersey Public Health Institute, allowing conscientious exemptions for mandatory childhood vaccinations will significantly increase the number of unvaccinated children for the entire community at risk. Modern vaccines have saved...
Just a minute. Now, we're not going to have these outbursts. Please, I didn't hear people shouting from the audience when the people were fairly good testifying. Move the quorum, please. Mr. Harris.
Yes. Modern vaccines have saved millions of lives from scourges like measles, mumps, and diphtheria. One study exempted children were 35 times more likely to contract measles. In another, they were 6 times more likely to have had pertussis, also known as whooping cough. Vaccination is a social compact, a duty to do our part for community protection. Unnecessary exemptions endanger all vulnerable people in our communities, including children too young to be vaccinated, people with compromised immune systems, pregnant moms and their fetuses, and other children with incomplete immunity. Like many others, I have witnessed the devastation caused by infectious disease. My cousin was born deaf because my aunt contracted German measles when she was pregnant. While in practice, I was called to treat a beautiful young woman admitted with meningococcal meningitis. In a matter of hours, what started out as flu-like symptoms turned into a desperate race against a deadly disease. In the end, she was fortunate to lose only a few fingers and toes when the bacteria clogged her arteries. In 2009, 3 unvaccinated children from Pennsylvania died from HIV. In California, 10 infants too young to be vaccinated died from pertussis. In each case, the cause was clear and deadly. It was the viruses and bacteria found forcing through their blood, lungs, and brains. In states that allow easy conscientious exemptions, the number of unvaccinated is 3 times that of states that allow strict religious exemptions.
Okay. All right. Thank you.
Yeah, thanks very much for I am just offering my testimony that talks about the legality of the religious exemption in New Jersey. I go through case law. I just wanted to give a legal perspective.
Wait a minute. We're talking about conscientious objection.
I understand that, but I was asked to speak on the issue that the conscientious objection is not necessary because our current religious exemption law might be unconstitutionally sound. I don't think that that would be appropriate given what's going on here, but I was asked to speak on that, and I have testimony for that if you do have any questions about it.
Okay. Don? That's who you are there. Thank you for signing. Push the light on.
Is that right?
Yes.
Okay, I'm Peter Wenger. I'm a pediatric, board-certified pediatric infectious disease physician who's practiced in New Jersey for the last 20 years and also with an epidemic when I was epidemic intelligence officer for the CDC, investigated epidemics around the world for a number of causes. Well, I'll make it short. I mean, really, the state laws that do require immunizations for school entry have greatly contributed in our efforts to prevent diseases, and in some cases have even eliminated them. As Dr. Harris just testified, there is clear evidence that the more exemptions you allow, the easier the exemptions allow, the greater the risk of these diseases appearing. There's been a lot of very emotional testimony given. I certainly appreciate what I've heard so far, and we appreciate the illness of all children. However, these diseases have overwhelmed children, where we still see numerous deaths around the world and in the United States. Last year, in the flu epidemic, we saw over 1,200 deaths in children due to influenza. This is more than we've seen at least in the last 35 years due to influenza, a novel influenza. We see now currently outbreaks in California, which has very lenient exemption laws. A huge, over 8,000 cases of pertussis, more than they've seen since the year I was born, 1950, and 10 deaths in infants. So to state that before that there were no epidemics and there were no outbreaks is absolutely not true.
Thank you. Thank you, stand by, because I think there's some questions for the medical experts. Hang on until we get to it. Want to ask a question now? Or going to wait to the end?
Chairman, I asked if the panel wanted to ask the previous doctor.
I know.
And you wouldn't allow it.
No.
And now you're requesting
Let me
it.
finish. I said at the end, I asked what you said. I was going to ask them to stick around in case there are questions at the end. Let me finish. So, want to ask questions of whomever, you'll get an opportunity to do that. Thank you to this panel. Now, Ms. Fisher. Dr. Fisher? Dr. Franco? I don't know if they're together now, but I'm just going to skip on by. Ms. Kraft. So everybody, while you're getting up, you're in place. Dr. Fisher.
Thank you. I'm Meg Fisher. I'm a pediatric infectious disease doctor. I practice in Monmouth County, and I'm the Vice President of the New Jersey chapter of the American Academy of Pediatrics. And we thank you for allowing us to talk. Today we're representing the New Jersey chapter of the American Academy of Pediatrics and the New Jersey chapter of the American Family Physicians, as well as the New Jersey Immunization Network. You've already received by email our testimony and why we're opposed to this bill, so I don't want to talk about that, but I would like to relate my personal experience with vaccine-preventable diseases. I started practice in 1975 in Philadelphia at St. Christopher's Hospital. Literally every week we admitted a child with serious bacterial infection. Although most survived, many were left with permanent disabilities such as deafness, seizures, and brain damage. I watched a young boy with leukemia who was in remission. He had recovered from his leukemia, and yet he died of chickenpox because we didn't have a vaccine at that time. In the 1990s, I watched a beautiful young girl come into the emergency department with chickenpox and group A strep. She walked in, but the infection rapidly overcame her, and before the night was over, she had died. She died despite the fact we gave her antibiotics and antivirals that were effective against these conditions. She died because the infection overwhelmed her, despite good therapy. During my career, vaccines against Haemophilus, pneumococcus, chickenpox, and rotavirus have been licensed, and the number of children with meningitis, epiglottitis, chickenpox, and dehydration has dropped dramatically. These vaccines work. They protect our children, but we need to ensure that as many children as possible are vaccinated.
Okay.
Thank you.
That's me.
Hi, my name is Jean Kraft, and I'm